As all of you know by now that I practice surgical and non-surgical aesthetics. And this is a very common question that I get in my practice is that doctor, is breast lift possible without surgery? And this has become increasingly common in my practice now. So breast lift without surgery, is it even attainable or achievable? If yes, to what extent? And if not, then what are the options in surgical? So obviously, I've put out many videos for breast lift and breast reduction and breast surgeries in general. So obviously, you all know about that and you can look at the videos, you can go and watch them for more information. But if I talk about non-invasive aesthetics in breasts, the role is very, very limited. And often I get asked about thread lifts for breast lift. I'll tell you a very simple answer, and that is that it does not work. The reason is that when breasts sag, there can be various reasons for that sag. It can be heaviness, it can be loss of collagen, elasticity, then the sagginess after lactation, due to aging, hormonal changes. There's so many factors that are affecting the breast tissue. So right from puberty until menopause and after that also. So pregnancy, lactation, so many things happen in a woman's life and that affects the breast tissue and the volume increase, volume decrease. So a lot of up and down happens with the breast tissue. Now what happens is that when we are aging or when there is post-lactational involution of the breasts will lose volume and they may also sag. And since it's a tissue which is not plastered to the body, obviously it will sag a little more than the other tissues in the body because they are more strongly hitched to the bone. Here, the breast tissue is actually connected to a fascia of the muscle, which is a layer over the muscle, and through that there are certain ligaments or certain strands of tissue that are connecting the breast to the body. So obviously, as we age, these strands also become weak and loose, and slowly you see that the breast is sagging down. So now you can imagine that for any non-invasive procedure to be helpful, it has to have that strong lift and has to be sustained also over time. And how improbable is that? So that is why a surgical breast lift, what it does is that it actually removes the excess tissue, it removes the excess gland, and it rearranges the breast tissue in a more lifted position, and then the skin envelope also becomes tighter. So obviously, it is going to work 100% of the time whenever you get a breast lift done. But for non-invasive, what are the options? Options that are asked by the patients themselves are doctors do fillers work. Now you have to understand fillers are not approved for the breasts, and if you're getting fillers done, then for the large volume of fillers that you will require, it provides a very little lift. Also, you have to get it done often. Safety is not really researched in the breast fillers, and that is why I advise my patients to stay away from it. Now, about thread lifts. You will have to put maybe, I don't know, hundreds of threads to provide a lift which can be sustainable. And again, the threads also will dissolve over time and they are not going to provide you any lasting result. So obviously, thread lift is also out of the question and it does not in any way match to the surgical breast lift. So what does work? And it is not a non-invasive option, but a less invasive option. So if you have sagging due to extreme volume loss, then fat grafting will work for you. If you have fat in the body, in the abdomen or the thighs or from somewhere that we can take and graft it in the breast, then it provides you natural volume with the fat. And that is going to give you a good lift if your sagging is due to the volume loss. So definitely with fat grafting, you can achieve a good lift. This is done without any major cuts and we take out the fat via cannula, which is a small hole that is created in the abdominal skin or the thigh skin, and we can take the fat from that and we inject in the breast also by cannula, and that requires a very tiny hole, no major cuts or incisions, and not even a stitch is required in the breast grafting process. So with volume loss, you can opt for fat grafting. But of course, there are other options like implants. If there's a more volume loss, if you don't have fat, then implants will give you a good lift also, giving you volume as well. Then, of course, there is the classic breast lift with an anchor scar or the vertical scar, whatever is suited to your body type, we can do that. So, the simple answer about non-invasive methods working for breast lift, they don't work to last long. And of course, I'm not even talking about the creams and lotions and everything that the patients waste their time and money on. And these do not work. And yes, if you exercise well, to tone up your pectoral muscles, which is right here. If you tone up that muscle, then because of the tone of the pectoral muscles, the ligaments also get a lift and you can achieve a decent degree of breast lift if you tone up your pectoral muscles. But again, this is a lifestyle change and you must be committed to again maintaining those results. So I hope that you've got your clear answer about non-invasive methods working for breast lift or not. So if you like this video, then do share it with your friends or those who may need this information. And keep watching our channel SB Aesthetics. We keep posting very interesting information about plastic surgery and skin treatments. Do keep the notification bell on so that you can get notifications for the new videos. Thank you for watching.